Let's talk a little bit about LASIK complications. And boy, there's some horror stories out there, aren't there? The reality is that the science of LASIK is so much better understood now, and maybe that word hasn't gotten out to people, but we actually know what causes the complications from LASIK and how to fix it. Probably any complication you've had from LASIK or PRK or laser vision correction, highly likely can be fixed by us and by other people doing techniques like us. And a lot of those problems can simply be avoided. Let's go over what happens as a complication in LASIK. First things that happen that we all know about, like infections and inflammation, heck, we avoid that by using medication and keeping the area clean and all that. But God forbid you get an infection, you get a scar or something like that, that can be fixed. That's the subject of a different video. But the really good way to avoid all this is just use the medicines, follow the direction. We're kind of going from smaller to bigger right now, okay? Dry eye treatments today are amazing. The last few years have changed the game on how we treat dry eye. Dry eye, if it occurs in LASIK, studies show the majority of the loss of tear film returns at about 3 months. And if there's anything significant, it is absolutely treatable. There's no reason dry eyes can't be treated for LASIK at all. Third, people complain about glare and night halos. And then people complain about loss of corrective vision or refraction, or that the LASIK quit working over a period of time. Lastly, they talk about the correction being off, blurry vision. That's what we're going to talk about a little bit more here. And so part of the issue is when you do a laser vision correction, the laser has to be done symmetrically and properly on the cornea so it focuses light properly on the actual retina, which is like the digital imaging module of the eye. It's like the film of a camera. The retina is in the back of the eye. The cornea does most of the focusing on the front of the eye. That's where the problems mainly occur, if they're going to occur. And so if you have, for example, a cornea that reacts where it's too nearsighted or too farsighted, it can leave you with blurry vision. Why could this happen? It turns out there's a biological reaction that corneas have with the laser. In other words, when you take out tissue with a laser from a cornea, every pulse is supposed to take out X amount of tissue, and that's based across an average of many corneas. Well, as you and I know, there's always somebody who's outside the main averages or beyond, like for example the 2 standard deviations on a bell curve. But these are people that are outliers where the actual correction of the laser, the amount of tissue it takes out, is off. It just takes out a little too much or a little too little, and we know this. There's studies that are showing this today and that have examined this and tried to find patterns, young, old, age type of correction. Really not much of a pattern. There are some people that just are a different biological variation. What do you do with these? You treat them. You really don't have to wait 3 or 6 months like a lot of doctors want to do. You treat these people. If you have somebody that does not have any kind of change after the procedure over a period of time, it just comes out off, there's no reason to wait months and months and months and months and months for the epithelium to recompensate and try to change the correction. That's old school thinking. So you can actually correct these people if you recognize that it's a biological reaction. Second, there are some patients that actually have kind of thicker, boggier corneas that have a biomechanical reaction to the making of a flap. It changes the cornea a little bit, so the laser applied, depending on the actual procedure used, it can become off because you can't, in the middle of a surgery, recognize a change in the cornea. What percentage? This happens in a few percent of people, but these people usually end up with astigmatism, glare, halos. A lot of them can just be simply corrected with an enhancement. That's done. We've written a paper about this. Some of them, the biomechanical change is significant enough that you have to have a topography guided ablation, but that's really the small minority of this. That biomechanical change occurs in a few percentage of patients. It usually just results in some subpar vision and an enhancement that's necessary. Now we're getting into the bigger stuff. What happens if now you actually have significant corneal flaws or aberrations? These are the little, we call them whoop-de-doos, the little waves or the little irregularities in the cornea, not because you're nearsighted or farsighted or you have astigmatism. Astigmatism is just out of round. It's because you actually have a cornea that's just not shaped perfectly, just like everything else in our body. It's not a perfect dome, if you will. Those flaws, if they're significant, can actually cause some compensation by the surface skin layer, called epithelial compensation, and throw off the correction. Well, what happens then is you end up with some residual astigmatism. If that occurs, you do an enhancement, you're okay. These are not the tragic flaws. These are all stuff that we can take care of that are annoying but not terrible. Where we really start running into trouble is when the laser is not applied properly for technical reasons. This is when you have the laser correction not done in the center, it's done off center. The reason is the tracking systems. Tracking systems have to be able to follow the rapid eye movements of a cornea during the procedure. And then what happens is the fastest eye movement is called a saccade. It's 0.2 seconds. 0.2 seconds, that eye goes, moves. That means that's a 500 hertz eye movement. So to keep up with it, you gotta have a laser and a tracker that functions at 500 hertz. That machine, the EX500 Wavelight, has a 500 hertz laser head. The laser head can move as fast as the fastest eye movement. It has a 1000 hertz tracker, means it double over samples. It's sampling twice for the fastest eye movement, so we know right when it begins. If you get a 2000 hertz tracker or something like that, sounds better, but it's really limited by the fastest eye movement and by how the laser head can keep up with it. There's really no laser out there that has a faster laser head than 500 hertz. There are many that are slower and slower trackers. One of the popular lasers out there has a 50 hertz tracker. That means it's 10 times slower than the fastest eye movement. That's a problem. And it's a 40 or 50 hertz laser, which means the laser head can't keep up either. And so what happens is I've actually seen patients where we actually see on the cornea where, and the imaging, where the laser started and where it moved and where it ended. It literally makes a asymmetric correction because the laser could not keep up with the eye movements. And the doctor doesn't really have control over this. This is a technical issue that certain lasers have if they are slower tracking systems. Another problem, when you have these irregularly shaped corneas or this decentered ablation, sometimes you can actually see good at the beginning because you're decentered, but you're kind of still seeing out of where the ablation was. But the problem is that over time, the surface skin layer, it sees an abnormal shape underneath its skin and it tries to compensate. And what it does is it starts filling in the low spots and thinning on the high spots, and it changes the curvature of the cornea. It's just a mechanical thing. It doesn't know it's better. It just does it. Well, that ends up changing the correction. That is the major reason why patients, their LASIK goes bad. If it's really decentered, that's every patient you heard, their laser goes bad in a year or 2 years. If it's actually more slightly decentered, it just takes longer. How do you fix those? You reconstruct the cornea. You essentially take that decentered area, and instead of lasering symmetrically, you need a topography-guided ablation procedure that takes out the part that wasn't taken out to make one big smooth area again. A smaller variant or a lesser variant of the decentration is a small shaped ablation. It's just not very big. It ends up looking, instead of like a smooth, flatter cornea for myopia, it's got a really volcano shape. And the sides scatter light and give you a lot of glare and halos. Obviously, an irregular cornea is not going to focus light properly, and you're going to get halos, glare, doubling, ghosting, blurry vision that really is very hard to fix, which is glasses or soft contacts. You have to use a scleral lens or, like I said, a topography guided ablation to fix it. And a variant of that, like I said, is a small correction. A correction that may be reasonably well centered, but it just wasn't done very wide, and you're a person with big pupils, and as your pupils open up, it just scatters light. So it has a very abrupt shape, like a volcano, or it was a hyperopic correction. It looks less like a dome and more like a nipple. And that is really something that can cause a lot of visual aberrations, and that is the kind of stuff we can fix with topography-guided ablation, where we segmentally remove the tissue to make it one shape again. Or you can wear something called an RGP or a scleral lens, a hard lens that makes a new surface. Usually these are helped some by glasses or contacts, but not completely. Then we get into corneas that are really irregular. We have certain systems like wavefront guided, and they take whole eye aberration shapes. And sometimes those shapes can be not very high resolution. They still can improve a cornea, but the problem is two things. One, if the tracking system isn't fast enough to put those shapes in the place it's supposed to go, you've got now an even more irregular cornea because you put it in the wrong place. Even when you have a lower resolution and not so specific that it's actually more of a gentle change to the cornea, it's still going to cause an irregularity to the cornea, plus that epithelial compensation we talked about. And these are the patients that really run into trouble. These are the horror stories. It can't be fixed. Yes, it can. I had terrible blurry vision and they did enhancements and it didn't get better. I had glare. I had night halos. I constantly have ghosting. And you get these patients in and they just don't have a symmetric cornea anymore. They literally have, I've seen patients, this is the center of their cornea, the laser was done here. It's remarkable. I can't believe this technically that far off, but we have seen these. And those are the horror show patients, the ones that nothing can fix, that just always seem to have problems. Well, we can fix those. The technology's been around for a number of years. We fixed quite a number of these, and you can fix this. You have the choices of getting a hard, rigid lens, like an RGP or scleral lens, and what it does is it creates a new artificial surface that goes over the irregular cornea and the tear sandwich in between to fill it up. Some people don't like that. They really just don't want the glasses or contacts anymore. And you can't do this with glasses with the irregular astigmatism caused. So what we do is we can reshape that and fix that. And we really do help patients. So there are choices out there. It turns out the majority of complications of LASIK are not only not a mystery anymore, they're all really treatable. So, on that note, let's have you meet Michael. He's an outdoor guy and he's a surfer, and he ended up many years ago with laser vision correction that ended up with a number of problems, and we fixed this. Let's have him describe his problems and talk a little bit about this. You can kind of match someone's experience a little bit with what I've been telling you.
My name is Michael, and I originally had LASIK eye surgery in May of 2022. After a long period of doing extensive homework and trying to find the best doctor, I had settled on a doctor who I thought was the best in the industry. This was in the state of Arizona. Decided to have LASIK surgery. Right after the procedure was finished, I knew something was wrong with my vision, even on that first day. My sight just didn't feel right. This continued into the next few days as it was healing. The worst part of it, though, was really the constant headaches that I was getting. I was getting headaches as if my prescription wasn't right, as if something just wasn't right within my eyes. A few months into it, I went back for my follow-ups and they kept telling me everything was fine, and I was complaining I was getting daily headaches. My night vision was absolutely atrocious, and my vision quality, even during the day, was just much poorer than when I had contacts or originally was wearing glasses. So a couple months after that, I went for a second opinion from a LASIK doctor. They said the same thing, that everything is fine. The LASIK doctor did a great job. Everything looks good. The headaches at that point were nonstop every day. The vision quality was poor. The night vision was absolutely atrocious, like I said. So I knew nobody could tell me that everything was fine when I knew something was wrong with my vision. I was very lucky to come across Dr. Motwani. I believe it was a LASIK Repair forum that I originally heard his name. And I started doing some research, and I said to myself, what can hurt from, going and getting a consultation with Dr. Motwani? So that's what I did. Within a matter of minutes after the consultation, after the test that Dr. Motwani ran, he was able to tell me exactly what was wrong with my eyes, which I knew there was something wrong with them. And my LASIK procedure had been performed with very outdated equipment. And a lot of the LASIK procedures that are going on around the country are using very outdated equipment that are not able to keep up with the eye movements. So you end up getting a ablation that is off-centered, and that's what mine was. And again, I'll let Dr. Motwani better explain that, but that's what was causing the constant headaches, the poor vision at night. So I elected to have a second procedure with Dr. Motwani. And just like the first day when I had the original that I knew something was wrong, the very minute that I got up from the table with Dr. Motwani's procedure, I knew my vision was absolutely incredible, more than I could ever put into words. Just from sitting up from that procedure, I knew that my vision was repaired. And over the next few weeks, it continued to get better, to now where I'm almost 20/15 in both eyes. The headaches are completely gone. The headaches were gone from the second day. My night vision's incredible, and that really is thanks to Dr. Motwani, the equipment that he uses, the techniques he uses. And I really urge anybody that's lucky enough to be watching this video, if you are struggling with some sort of, LASIK prior surgery that you're not happy with, to reach out to Dr. Motwani, have a consultation, and let him give you his honest expert opinion on what's going on. I couldn't be more happy, couldn't be more thrilled.